Hello, I'm Dr. Igor Simonov, and today I will continue our talk about use of acupuncture pulse diagnosis Wu-Sing and use of the pulse map for treatment of patients with the Ba-Gua balancing method. In the difference of the usually used the balancing method, we will not balance the symptom of the patient. We will balance actually the condition showed by pulse. So here we have the pulse map of patient who came for the treatment with a headache, blocked nose and severe cough for a couple of days. What we see here will remind, here we have the lung meridian, heart meridian, spleen, a pancreas meridian, liver, kidney meridians. And here we have the full organs, large intestine, small intestine, stomach, gallbladder, sanjiao, and the urinary bladder meridian. What we can notice here that Zhang organs are not affected. So if we would use just very popular way as many practitioners use the balancing method, we would try to balance, for example, lung meridian with some other meridian, but in reality lung meridian is not affected. Large meridian is not affected either. What we see here is a deficiency in stomach meridian, deficiency in gallbladder meridian, and excess in urinary bladder meridian. So what we need to do, we will need to treat these three meridians: stomach, gallbladder, and the urinary bladder. It doesn't matter that patient has actually cough and the blocked nose and headache. We don't see anything in the happening with the lung. So first of all, we will treat urinary bladder meridian as more affected, very big excess here. So we use the sign Tian, belongs to urinary bladder meridian. And if we will see which organ and which meridian is in the level of urinary bladder meridian, we find that it is actually spleen. So in the top we use the 3 gram Tian, Gua sign Tian, and in the top we use Li, which belongs to the spleen, urinary bladder spleen. To make it work in autumn, because patient came in autumn, we need to change the top sign, and we need to use change just upper line. In this case we will need to use 1 to 3rd point of the spleen, pancreas meridian, and pancreas is in the movement of the earth, so it's the same point we need to use for this meridian. We use only puncture only point number 3 of the pancreas spleen meridian. Later, let's treat stomach meridian. So what we can find, the stomach meridian is in the level of the heart meridian. So here is the stomach meridian, and here is the 3 gram Gua sign of the heart pericardium meridian. For make it work in autumn, we need to change this hexagram. So how we change it? We actually need to change the first line of the stomach meridian. For this, we will use the point number 45 of stomach meridian, and the first line of the pericardium meridian. So for that, we will use wood point of the pericardium meridian and the metal point of the stomach meridian. In this case, this hexagram will work very good in autumn. And the last meridian we need actually to balance is the gallbladder meridian, which also is in deficiency. So we use again what we have. The gallbladder meridian is in the level of the lung. So we will need to use in the bottom the sign 10 of gallbladder meridian, the same like urinary bladder meridian, and in the top we will use the sign of the lung, sign Sun. So to make it working in autumn, we need to change just one line, the third line, top line of the gallbladder meridian. So we will use point number 41 in gallbladder meridian, the wood point of gallbladder meridian. And as in the lung we will need to use the only metal point which corresponds to the movement of the lung, is the metal point of the lung meridian. So during the treatment, patient noticed straight away some kind of movement in his sinuses, and he had not any more headaches. And the next day, early morning, patient actually noticed that he had not cough. He had just one productive cough with a lot of discharge, phlegm, sputum discharge, and after that he had not any more cold, he had not any more nose congestion, and he had not any more headache. So once we see the result readings of the pulse, we need to treat, instead of the symptom, we need to treat the condition. So sometimes this condition appears in absolutely unexpected meridians, like in the case of cold and cough, like urinary bladder, gallbladder, and stomach meridian. So once we treat them, one treatment is sufficient, was sufficient for that condition to heal patient, so he improved and he had not any more cough. Thank you.